So do you have pain in the shoulder while doing overhead activities, or do you have weakness in the shoulder while lifting weights? You may be having a rotator cuff tear. Rotator cuff comprises of four muscles: subscapularis in the front, supraspinatus and infraspinatus in the top, and teres minor at the back. So these muscles work in coordination to lift your shoulder up and also makes possible to do overhead activities. So any tear in the rotator cuff, you may have pain, you will experience weakness. It can be diagnosed with a clinical test and by doing MRI. So MRI will reveal the extent of the tear and the thickness of the tear. Small tears don't require any surgery. They can be treated with conservative management alone with strengthening. Bigger tears will require surgery, treated using arthroscopic minimally invasive technique, which has a high success rate and less morbidity. So today we are going to talk about ACL reconstruction prehabilitation. So prehabilitation is something you do before surgery. This is to make you ready for the surgery. So it is mainly aimed at three things. One is to strengthen your quadriceps muscle, second thing is to reduce the swelling, and third thing is to improve the range of movement in the knee. To reduce the swelling, you are advised to do icing 2 to 3 times a day, at least 10 minutes, and also to apply crepe bandages to reduce the swelling. To improve the range of motion, you are advised to do knee bending exercises in sitting posture, in prone position, as well as in lying down position. At least 20 repetitions. Try to make it comparable to the normal knee or uninjured knee. Third thing is to improve the quadriceps strength. You should do straight leg rising and static quadriceps exercises. And also you can do hamstring curls and glute bridges to improve the hamstring strength. So these things will improve your performance post surgery. Does your shoulder pop out from its normal position more than once? Do you feel like your shoulder is giving away when you are doing a throwing activity or any overhead activity? This is not normal. This is called recurrent shoulder dislocation. Your shoulder is the most mobile joint in human body, and that's what makes it inherently unstable joint. A person who has a single episode of dislocation will have chances of recurrent dislocation in future. During the first episode of dislocation, the soft tissues around the shoulder becomes lax and they also even get torn. So this makes way for multiple recurrent dislocations in future. What are the reasons for recurrent dislocation of shoulder? So the first episode of dislocation, which can happen during any kind of overhead activities, are most commonly involving sports injuries like while playing cricket, football or volleyball. And also patient who ignore during the first dislocation of not having proper rehabilitation can have recurrent dislocations in future. So the treatment for shoulder dislocation depends on the severity of injury. Usually the first time dislocators only get physiotherapy and rehabilitation. Recurrent dislocators will require surgery in the form of ligament repair using arthroscopy. So arthroscopy makes the surgery simple, the healing time is faster, and the pain is very less. So when to seek help? So if your shoulder has dislocated more than once, please don't ignore, kindly get expert opinion. Did your knee get twisted recently and now you're feeling pain while walking? Did you injure the knee and now you're feeling your knee is locked in certain position? This could be a meniscal tear. Inside your knee joint, if you see, there are two C-shaped cushion-like structures on either side. These are absorbing the forces across the knee joint and helping in smooth distribution of this load. When this gets injured, it will lead to a meniscal tear. Usually happens when there is a knee twisting injury, which may be associated with a sports injury or a road traffic accident, or it may be simply a result of wear and tear due to age-related changes. So when do you have to worry? Suppose if your knee is constantly having pain even after 2 to 3 weeks of injury, and if your knee is getting locked recurrently or repeatedly, you should consult the expert at the earliest. The diagnosis is made by doing clinical tests and doing the imaging such as MRI. Smaller meniscal tears or degenerative tears will only require physiotherapy and rehabilitation, and larger tears will require repair using arthroscopy. techniques. So arthroscopy is the most effective method to repair the meniscal tears, very minimally invasive surgical technique with faster recovery and very less pain.